trying to do is create a national sort of model curriculum or that really focuses on the needs of these vulnerable populations. And we have an opportunity together to provide input into this process. And the exciting thing for me is we are, with our new dean, engaged in this curriculum transformation process over the next year to year and a half. So it's going to allow us to embed what we're doing here at a national level into our curriculum at a local level. And so we have, through the introductions you heard, we have a number of people from our medical school here that are participating in curriculum or in leading the curriculum transformation process at Meharry. So with that said, I just wanted to point out a few things. One, as I said, many of you don't have medical education experience or expertise. We try to put together in our program reading lists, sort of or bibliographies that provide some background information on a number of topics. They provide, they're on the four, the research projects, our year 1 and year 2 research projects. We'll talk more about that later. The year 1 projects were around physician implicit bias and how medical schools are teaching students to be aware of their own implicit biases. So we did a comprehensive, a systematic review of the literature to see what was out there. And as you might expect, there's not a whole lot out there. Our second topic for year 1 was to look and see how medical schools have adapted in terms of training their students to prescribe PrEP or pre-exposure prophylaxis to prevent the transmission of HIV. And what we found is there's absolutely nothing in the literature on that. And so, and what we, in terms of talking to college, we understand is that it hasn't really been formally introduced into the curricula of medical schools. And so it's an opportunity for us as we begin to look at and understand how medical schools educate students and what are those opportunities across the 4 years. The first 2 years, as Dean Mallett said, are sort of the preclinical years, and in years 3 and 4, they do their clinical rotations. That model is changing. We're moving to, some schools are moving to a 3+3 model, not just a 3+4. 3 years of medical school, 3 years of residency, and you may have heard that Meharry recently entered into an agreement with MTSU, Middle Tennessee State University, to do a 3+3+3 program. 3 years of undergraduate medical education, or 3 years of undergraduate education, 3 years of medical education, and 3 years of residency. So that program will be starting next year. So there's a lot of moving parts here, and you know, one shoe's not going to fit, or one side's not going to fit all feet. And so, you know, what we want to do is come up with, as we look at the different opportunities that exist in terms of medical education curriculum, is talk about how we can begin to introduce some of the concepts and some of the tools that to help students better address the needs of these vulnerable populations. And so our again, you know, we have the 3 vulnerable populations, again, LGBTQ, lesbian, gay, transgender, and questioning is the one population. The homeless population is a second group of the vulnerable populations. The third group is migrant farm workers. So those 3 vulnerable populations we will be tracking across the 5 years. And then each year the research projects or the topics that we focus on will change. And so for year 2, our topics are going to be interpersonal violence across the lifespan. How are we teaching our medical students to address interpersonal violence? Everything from child and sexual abuse to dating violence and to domestic violence and elder abuse. Again, it occurs across a lifetime. And so, you know, there's not traditionally sort of an integrated approach on how we look at that and how we train our medical students to address that. The other topic that we're going to be focusing on this second year is adverse childhood experiences, or ACEs, and that has been becoming, we're becoming much more aware of the effect of exposures to childhood traumas and domestic or domestic dysfunction, household dysfunction at early ages, and the impact that is having on the health of, that goes in terms of the stressors that are occurring early in life appear to be affecting health outcomes later in life, chronic diseases, cardiovascular disease, those sorts of things. So that is something we want to focus on. And again, that's not really, we haven't found that being introduced into the medical curricula at all. So as we move forward, you know, the overall program is structured to do what we're calling systems level research. It's one of our goals, and that's really to really do a comprehensive, systematic review of the literature to find out, the medical education literature, to find out what's happening around each of these topics. The second is to disseminate information to academic medicine primarily providers, but to healthcare providers as well, about what our findings are and make recommendations about what can be done to how we can better address the needs of the vulnerable populations. And the third goal is to establish a community, the community of practice, and that's really to inform the center, to help us better understand what are, you know, in terms of the evidence out there for best practices, and or to establish best practices in the field. And I think that's one of the things we're going to find. There's not a lot out there in the field, and what we want you to help us do is to identify, to represent sort of some of the populations and identify what the needs are, so that we can begin to, and help us identify how we can train or educate our medical students in this changing, transforming, you know, clinical environment. So that's the charge. That's really what, you know, that's what this is about. It's our focus, our outcomes are on medical education transformation, you know, and working with vulnerable populations. As I said, the research topics will change each year, but you know, we need your input to help guide us in how we can make recommendations to change medical education curriculum. And so that's sort of, I just wanted to provide that as sort of an introduction to what we're doing. I think we're gonna really go ahead and start the program. I think Mindy, I think you're up next. And I'm sorry, let me just introduce, I didn't introduce myself. I'm Paul Juarez. I'm Professor and Vice Chair for Research for the Department of Family and Community Medicine at Meharry Medical College, and I'm Director of our Health Disparities Research Center of Excellence.